Okay. So let us continue with our discussion. So we have ended up with drugs for pain control during labor. So we are now talking about regional anesthesia. So if we say regional anesthesia, it consider the area where it will identify the anesthesia effect. So just like for labor, we are using the labor and delivery as well. We are using local anesthetics, which are mainly identified po to have anesthetic effect on localized area, which mainly identified po when instances that it may need to have the episiotomy and may have the episiotomy or repair. So that will identify specific a local anesthesia. While on the regional block, if the client is subject already for a painless delivery, patient may have the spinal anesthesia, which mainly may consider the anesthetic effect from abdominal down. Okay? So, spinal, it could be spinal or epidural. But again, mainly, it's without the loss of consciousness. Okay? The general anesthesia could be with or without loss of consciousness, but the anesthesia effect is general. That's why the whole, the upper and the lower extremities. Now, what are those situations that regional anesthesia, epidural, spinal is contraindicated? If the patient experiences gestational hypertension, okay, so we have discussed uh, this topic mainly on the uh, gestational hypertension. The patient is having the hypertension without proteinuria. Okay. If the patient has bleeding disorders, specifically evidence of decreased platelet, because chances of the possible triggering of the bleeding, and if there is severe infection or sepsis at the site where we will introduce the anesthesia. So specifically in the spinal, okay, and that may travel with the possible infection. So in this consideration, these are the common pain control anesthetic used in obstetrics. So if you will notice, these are mga cane, okay, with those lidocaine injectable. So sa lidocaine injectable, category B siya. It's only on the localized, used during the episiotomy or episiotomy and episiotomy. The rest are category C. Ibig sabihin, number 1, number 2, and number 3, number 4, may possibly consider po an effect to the fetal. So that's why we really need to consider the monitoring of the fetal well-being, specifically the fetal heart rate. So usually pag spinal anesthesia, tetracaine and bupivacaine are given. So it will be introduced on the spinal area, and usually these are in the even in the United States we have the nurse anesthetists who are responsible for the preparation and administration. However, here in the Philippines, we're still working if on the regulation and recognition of such specialization. However, uh, the one that is commonly used is the bupivacaine, both for the epidural, spinal, and even cesarean delivery. So, there are some situations you need to remember this. Yung 0.75% of bupivacaine are not recommended because as based from literatures, 0.75 bupivacaine may cause cardiac arrest. Kaya careful din po when these are being used. So on the other hand, we will now proceed to the drugs that enhance uterine muscle contractility. So, if we have tocolytics that prevent uterine contraction, uterotropic drugs are the one that induce or stimulate uterine contractility. Once the baby has been delivered and the placenta is already out, oxytocin is being released so that to facilitate the contraction of the uterine muscle. Because once it will cause the relaxation, pwede pong mag-cause ng uterine atony. The uterine atony is the relaxation of the uterine muscle, thus causing what we call bleeding. So if for example, there are evidences po that the uterus is not contracted. So the patient may receive po oxytocin, oxytoxic agent, although it's category C because mainly these are also being given to stimulate the to stimulate contraction if it is not progressing po yung labor. So this is to induce labor. Second is this is post delivery. It's to prevent hemorrhage and to prevent uterine atony or relaxation of the uterine muscles. If we don't have the oxytocin, we have the methylgornobin maleate or commonly Metergine. It's category C also. These are given po usually po pagka post-abortion, yung mga nagda-dilatation and curettage. So in colloquial, it's RASPA. Uh, the patient to prevent post hemorrhage subinvolution. So this is related to bleed post partum bleeding, post-abortion hemorrhage, Metergine are being given. However, ang Metergine po is not given sa mga patients po natin na may infection at labor induction kasi tandaan po natin every time that may cause the contraction, nagde-decrease ang blood flow. So that's why this must be the one that you must take into consideration. Okay, so I think it ended up the discussion mainly on the drugs on pregnancy and lactation, and these are the topics, the last topics that we may discuss, hoping in a face-to-face meeting po. So probably on the last day of our meeting, we'll do the face-to-face meeting, and we will take up the cardiovascular and the respiratory drugs. These are the last topics that we will have in pharmacology. However, we will have the self-assessment exercise. The self-assessment exercise will start at 7 o'clock up to ano naman ito, Wednesday at 4 o'clock. And the focus or the coverage of the the self-assessment exercise is more on clinical trials. So I'll stop my recording.